There are a lot of organizations that do great good for families that suffer hardships like this. Let's talk specifically about a child having cancer and what a family goes through when that happens. Maybe that's happened to you. Maybe it's happened to people you know. Or maybe it will happen and you won't know where to turn. The Yale Cancer Center is one of the most prominent places in the world. They are amazing people with pediatric oncologists, social workers. They know what families with cancer go through. Now let's give you a little more insight into that and hear from the Yale Cancer Center.
When a family gets the news that their child has been diagnosed with cancer, they're stunned. They're in shock. It actually takes a long time for it to sink in. I would say it really takes at least 3 one-hour conversations for our parents to really understand what is happening to their child and how we're going to work together to make the child better.
No matter what comes before the final diagnosis, no matter how much the family may suspect that their child may be diagnosed with cancer, when you first use that word and you first give the news that this is in fact cancer, that family emotionally often just shuts down, and it's all that they can do to remain in the present moment. We generally say that families retain only about 10% of the information that you give them when you first give them that diagnosis. So at the initial diagnosis, it's not uncommon for families to remember almost nothing except for the fact that their child has cancer.
That's one of the reasons we always try to be the first ones to share the news with the family when we think there's even a chance of it being cancer, because there's so much question and worry immediately, and we're able to say that we're going to be there no matter what it is, and we will do our best to bring the child to good health.
The issues that the family is about to be faced with from an emotional point of view, a financial point of view, employment point of view, they're really wide and varied. It depends on the situation that the family's in emotionally and financially, but almost every family is going to come away with a sense of shock.
There's a lot of worry in the beginning, a lot of shock and disbelief, but with multiple conversations together, we arrive at a plan so that we can turn that worry into different energy to help the child get better.
From a financial perspective, many of these families are struggling with taking care of their now sick child while maintaining a job. And for many families, it's just not feasible. We do what we can through social work and understanding the way that the system works. But sometimes it's just not possible to help these families keep their jobs.
Financially, I just recently did a research study in leukemia patients around the country. About 60% of parents have to either increase or decrease their work hours dramatically because of their child's diagnosis. And when looking at both parents, at least one parent, the 40% of the time is unemployed, but wanting to be employed. So there's a great strain on the family financially with less income coming in.
They really do depend on the family, what kind of emotional support they have going into the process.
Again, this is not just an event. This is an ongoing experience, because these kind of changes do have lasting effects on the family. When a child gets diagnosed with cancer, the whole family embarks on a journey. And we have a multidisciplinary team at Yale that consists of oncologists, nurses, nurse educators, child life people, child life specialists, social workers, and others.
We also have psychologists ready to speak to not only the family, but as well as, not only the patient, but also with the family and siblings. And we even have psychiatrists available oftentimes in our clinics to help these families through these very difficult times.
One of the most important things we do is have nursing education with the family to talk about what life is like day to day and what to do in terms of day-to-day care, because we want the parents to feel really confident about being able to take care of their children. What you do when you have baths but you have a central line, how should you eat? Is there anything differently you should eat? Which is, for the most part, the answer is no. But still, there's a worry with that. How to prepare the other children, those types of things, how to take medicine. And then with the social worker spends a lot of time talking about how the family was functioning before the child was diagnosed, what are the strains that are there, how to help with those, what are the support systems, how to shore up those support systems, and all the practical things related to letting work know and school know so provisions can be made, and providing support for the parents. Our child life expert, just wonderful, does play therapy with the child and siblings to explain what the cancer is at a level the child can understand and the siblings can understand, because the siblings are also very affected by the cancer diagnosis. So, for example, for children who are diagnosed with leukemia, our child life specialist will make leukemia soup with white cells and red cells and platelets with the children.
There are really many simple things that people can do to help a family in need. In a situation where a child is newly diagnosed with cancer, I think that we often see an outpouring from the community, from families, from friends, and everyone is asking the family, what can they do? And I think oftentimes the family is so overwhelmed that they can't even wrap their head around what it is that can be done. What we find helps most is when people who are meaning to do well come to the family and say to them, look, I'm going to do this for you. I'm going to cook at dinner tonight. I'm going to take care of your laundry. I'm going to take care of things that need to be done around the house. These are very simple things that I think friends and family can help out with and really take a lot of the everyday burden off the family.
Parents who have hourly jobs without benefits, they can be quite overwhelmed because there aren't so many options to keep an income stream in the family. And we look for help from other philanthropic sources for those families. For the first family that can take advantage of the Family Leave Act, we can talk to the employers about the duration, because it can be as long as 6 months, depending on the situation. And sometimes we're also able to talk to employers about options where maybe it's possible for the employee to do work remotely or participate in a different job role with different hours. But I do have to say it's gratifying. Most employers I've talked to or I've been asked to talk to really do are sympathetic and want to do the right thing. I also encourage employers to talk to members of the medical team, the social worker, the physician, or one of the nurses on the team, because all of these individuals on the team would be able to share information about duration of treatment and what's involved. Of course, the employer would need to get permission first to do that from the parent, but I think that in this case, most people want to give that permission so that the employer can help also come up with a plan that will allow the parents to continue to do as much as possible to stay in their job and help maintain benefits and income.
I think that many organizations and many charities are very well intentioned in providing resources for the patient, providing resources towards research, and these are things that absolutely need to be done. But I think that the burdens that the families face during this difficult time are often overlooked.
My best recommendation for a website for anyone, including employers, to really understand what the cancer experience is like is cancer.gov. That's a federal government site by the National Cancer Institute has highly accurate information with details about duration of therapy, the types of therapies that are needed, and I think that's a good place for anyone, including friends and family members and employers, to understand what the parents are going through.